Namaskara, I am Dr. Shankar. Today we are addressing a common concern among women with breast cancer, which is about breast cancer surgery. But here's the good news. Modern breast surgery isn't just about removing a tumor. It's about healing your body, protecting your dignity, and helping you regain your confidence. Surgery is often the first step in treating breast cancer. It physically removes the tumor and helps determine the cancer's stage, guiding further treatment like chemotherapy or radiation. Thanks to early detection and advanced techniques, many women can now have their cancer removed while preserving their breast. Option 1. Lumpectomy involves removing only the cancerous lump and a small margin of healthy tissue, leaving the rest of the breast intact. It preserves most of your natural breast, offers a short recovery time, and provides excellent cosmetic results. However, it requires radiation therapy afterwards to lower the risk of recurrence and may not be suitable for large or multiple tumors. I often tell my patients, if your cancer is small and caught early, a lumpectomy is like treating the enemy without destroying the whole fortress. Option 2. Sometimes when a tumor is large or there are multiple lumps, a mastectomy becomes necessary. That's the complete removal of breast tissue. It's the best option for large, widespread or recurrent cancers and may not always require radiation afterwards. However, it can be emotionally challenging, affecting body image and confidence. But remember, losing a breast doesn't mean losing your femininity or strength. Today, reconstruction options can help you feel whole again. Option 3. In a modified radical mastectomy, the entire breast and nearby lymph nodes under the arm are removed. This helps us check if the cancer has spread and guides further treatment. It is one of the most common surgeries in India for locally advanced breast cancer. The pros include removing cancer and affected lymph nodes in one procedure and reducing the chance of local recurrence. The cons are a longer recovery time and the possibility of arm stiffness or swelling, known as lymphedema. But with proper physiotherapy and care, women recover beautifully and can live fully functional, active lives. Breast reconstruction, healing beyond the scar. This is one of the most important advances in cancer recovery. Breast reconstruction surgery. In collaboration with plastic surgeons, we can recreate the shape of your breast immediately or later, using your own tissue or implants. Benefits include restoring your body image and confidence, often performed during the same operation as mastectomy, and significantly aiding emotional recovery. I have seen women walk out of surgery not just cancer-free, but smiling, standing tall, and feeling whole again. That's the true power of modern medicine. Comment on this video if you want to know in detail about the reconstruction surgeries of the breast. Each woman's body, cancer, and journey are unique. When choosing surgery, we consider tumor size and location, breast size, lymph node involvement, genetic and family risk, and your personal preferences. Talk to your surgeon. You're discussed with your options also. Remember, the goal isn't just survival, it's maintaining your quality of life after treatment. Surgery is not an end, it's the beginning of healing. When you walk into that operating room, you are not losing something, you are winning your life back. Let's replace fear with faith and myths with knowledge. I am Dr. Shankar, and this is part of the Breast Cancer Awareness series on Voice. If this video helped you, share it, because awareness can save a life today. I am building a genuine community that is truly determined to reduce cancer occurrence and prevent death from it. Please join us.